Sexual violence and misconduct are serious problems in NHS hospitals in England, but they are often hidden from the authorities and the public. A joint investigation by The Guardian and the BMJ has revealed shocking statistics that show how widespread and underreported these incidents are. According to data obtained from 212 NHS trusts, there were more than 35,600 incidents of sexual violence and misconduct in NHS hospitals in England over the past 5 years. These incidents include rape, sexual assault, harassment, stalking, and abusive remarks. They involve staff, patients, and visitors as both perpetrators and victims. But experts say that these numbers are just the tip of the iceberg. They estimate that more than 100,000 incidents are missing from the official records every year. This means that many cases of sexual violence and misconduct are not reported, investigated, or addressed by the NHS. Why are so many incidents missing? One reason is that there is no consistent or mandatory system for recording and reporting sexual violence and misconduct in NHS hospitals. Only 1 in 10 trusts has a dedicated policy to deal with these issues. The rest rely on generic policies that may not capture the specific nature and impact of sexual violence and misconduct. Another reason is that many staff and patients may not feel safe or supported to report sexual violence and misconduct. They may fear retaliation, stigma, or blame. They may not know how or where to report. They may not trust that their complaints will be taken seriously or handled properly. The consequences of this underreporting are devastating. Sexual violence and misconduct can cause physical and psychological harm to staff and patients. They can damage trust and morale in the NHS. They can undermine the quality and safety of care. That's why medical colleges and unions are calling for urgent action from the government. They want an independent inquiry into the epidemic of sexual violence and misconduct in NHS hospitals. They want a clear and effective process for reporting and investigating incidents. They want a single system to collect data and monitor trends. And they want a dedicated policy to prevent and address sexual violence and misconduct in every trust. Sexual violence and misconduct have no place in NHS hospitals. It's time to bring them out of the shadows and into the light. The incidents range from abusive remarks to rape, allegedly perpetrated by staff, patients, and visitors. More than 20,000 were cases of patients abusing staff, and more than 3,000 were cases of staff abusing patients. These are the shocking figures of sexual violence and misconduct in NHS hospitals in England. But experts say these numbers are just the tip of the iceberg. They estimate that more than 100,000 incidents a year are not being recorded and investigated by the NHS trusts. This means that thousands of victims are being denied justice and support, and that perpetrators are getting away with their crimes. Why is this happening? How can we stop it? And what is the impact on the health and well-being of those who work and receive care in our hospitals? In this video, we will explore these questions and reveal the hidden epidemic of sexual abuse in the NHS. Some NHS trusts reported very low numbers of incidents, raising concerns about underreporting and lack of investigations. For example, 59 trusts recorded 20 or fewer incidents over a 5-year period. This means that on average, they had less than 1 case of sexual misconduct per year. How is this possible? Are these trusts really free of any sexual harassment or abuse? Or are they hiding something from the authorities and the public? To answer these questions, we contacted some of the trusts with the lowest numbers of incidents. We asked them how they define sexual misconduct, how they handle complaints, and how they ensure accountability and transparency. We also spoke to some of the staff and patients who experienced or witnessed sexual misconduct at these trusts. What we found was shocking and disturbing. Some of the trusts told us that they have a strict policy of zero tolerance for sexual misconduct. They said that they encourage staff and patients to report any inappropriate behavior and that they take swift action to investigate and discipline offenders. They also said that they provide support and counseling to victims and that they monitor and review their practices regularly. However, some of the staff and patients we interviewed told us a different story. They said that they faced barriers and challenges when they tried to report sexual misconduct. They said that they were ignored, dismissed, or intimidated by the management or the perpetrators. They said that they feared retaliation, stigma, or legal consequences. They said that they felt alone, helpless, and traumatized. Some of the trusts told us that they have a narrow definition of sexual misconduct. They said that they only consider cases that involve physical contact or explicit verbal abuse. They said that they do not record cases that involve sexual jokes, comments, gestures, or innuendos. They also said that they do not record cases that involve consensual relationships between staff or between staff and patients. However, some of the staff and patients we interviewed told us that these cases also constitute sexual misconduct. They said that they felt uncomfortable, offended, or violated by these behaviors. They said that these behaviors created a hostile, unsafe, or unprofessional environment. They also said that these behaviors could lead to coercion, exploitation, or abuse. Some of the trusts told us that they have a lack of resources or expertise to deal with sexual misconduct cases. They said that they do not have enough staff, training, or equipment to handle complaints, investigations, or support services. They also said that they do not have enough data, guidance, or oversight to monitor or improve their performance. However, some of the staff and patients we interviewed told us that these are not valid excuses. They said that these are basic responsibilities and duties of any healthcare provider. They said that these are essential for ensuring quality, safety, and dignity of care. They also said that these are fundamental for protecting human rights and preventing harm. As you can see, some NHS trusts are hiding sexual misconduct cases from the authorities by underreporting and lack of investigations. This is unacceptable and unethical. This is putting staff and patients at risk of harm and injustice. This is undermining trust and confidence in the healthcare system. We call on the government and the regulators to take action against these trusts. We demand that they conduct independent audits and inspections to verify their data and practices. We urge them to enforce stricter standards and sanctions for reporting and investigating sexual misconduct cases. We also appeal to them to provide more resources and support for victims and whistleblowers. We also call on you, our viewers, to join us in this campaign. We ask you to sign our petition and share our video with your friends and family. We invite you to comment below with your thoughts and experiences on this issue. We also encourage you to contact your local MP or NHS trust if you have any concerns or complaints about sexual misconduct in healthcare settings. Together, we can expose and end sexual misconduct in NHS trusts. Together, we can make healthcare safer and fairer for everyone.